Can you explain what's that safety belt?
Oh no! When someone has a spirit, they have to.
Do you guys charge? What if someone like me wanted to consult?
What is going on?
Do you want to take this one?
My name is Suhayl Essa.
Dr. Ntlanta Vilagasi.
Dr. Brendan Matthews.
Dr. Naseem Sharif.
And this is the Gentleman's Clinic Podcast.
Hello and welcome back to another episode of the Gents Clinic Podcast. Today, the topic is Sangomas versus doctors. Traditional healers versus us medical professionals. In the studio, we have two lovely traditional healers that I'm going to introduce to all of you. But before I do that, if you watch till the end of this podcast, we're giving away a discount on something very exciting. So make sure you watch till the end. It's going to be in here somewhere. All right. So let's introduce our first two guests for today. First guest that I'd like to welcome is Dr. Aruna Bushili. Am I saying that right?
No, Shelly.
Shelly. Okay. I was trying to Africanize it up a bit. Dr. Aruna Shelly Bushili graduated with a Bachelor of Dental Surgery from the University of Pretoria in 2018, a One Young World Ambassador, a Resolution Project Fellow, and practicing traditional healer. Welcome. How are you?
I'm all right. How are you?
Great. Thank you. Thank you for being here, joining us today. And here is our second guest, Khosietsile Khomotso Mosidi, also known as Mkulu Vuzizizwe Nsizwa Kamlambo, born in Soweto, with a graduate degree in psychology from the University of Witwatersrand, our alumni. He's worked in the banking industry for over 15 years, holding positions in various sectors, from retail banking to corporate and investments, specializing in organizational development and design. He has been a traditional healer for over 4 years with a focus on teaching and development of traditional healers. Welcome, Khosi.
Ndauwe. Thank you.
Is that what how do I reply? Ndauwe back or
Say, aye.
aye? Aye.
I thought I'll probably need to ululate after you said this. Immediately when I thought of doing it, my voice said, nah, don't even try.
Don't even try. All right, let's get straight into the conversation. We're gonna have some rapid fire questions. We want to know a lot about you guys. We want to know about the background, and then we're going to go into some controversial topics with a little bit of background medical history from us, and then you guys can tell us how it differs in your world. So tell us, how did you guys become traditional healers? Aruna, you can start.
Sure. There isn't really a way to answer that question. You realize you have a calling. There are certain things that we can't get into, obviously, that indicate that you have a calling, and then you go straight into initiation, and thereafter you are a traditional healer. That is the best I can do to explain it without going into unnecessary details, which we, technically speaking, not allowed to talk about under Umthetho Weshoba. So,
what is Umthetho Weshoba?
So Umthetho Weshoba is sort of like a guideline and regulations for Sangomas that they follow, sort of. So it's sort of like what HPCSA would be to the Sangoma fraternity, sort of. So it kind of guides what we can and cannot do, what we're allowed to speak about in the public and what we're not, and also the way that we conduct ourselves in our traditional practice with our own initiates and so forth. So that is what Umthetho Weshoba is in a nutshell. I don't know if there's anything I missed.
Khosi, can you reveal more to us, or is this really a secret club?
Well,
we can't get any info.
Since we're all about controversy, it fundamentally boils down to if a healer went through the proper channels, the proper rites of passage. You know, now we have TikTok healers and Instagram doctors.
Yes, we've heard about them.
So
Yeah, they've stolen his identity, by the way. We have the real one in the studio, but there's one masquerading as him around.
Yeah. So we hold that the sacredcy of the whole procedure and process to heart. So as she's already mentioned ugogo that umthetho is what governs us. And yeah. So, and we're constantly reminded of that, to remain humble and follow umthetho weshoba.
Okay, so you can't exactly tell us about the initiation process.
Exactly. Can I just ask? I actually respect that a lot. That there are things that you can't talk about, and I think that maybe general society doesn't maybe have that understanding, and then that respect or admiration for the fact that it's kept. Because you guys, maybe you'll tell us later, you guard a lot of your tradition as well. And I'm just thinking, for example, with the Xhosas, there was a big uproar when that movie came out a few years ago. Ingleba, yes. Yeah. Because it was sort of exposing what happens when they go for initiation. So maybe just to mention, there's a lot in African culture that is guarded and kept safe and not put out there. I'm sure there are more deeper meanings why those things are safeguarded and just not thrown around in the public where everyone can say as they please. Is that sort of true? Are there sacred things, that are best kept,
Yeah, like Umkulu mentioned before, so you have a lot of people now parading as Izangoma, right? And the reason for this is because too much information now is out there. So there's one Sangoma or two or three papa, and they were like, yeah, if you're dreaming of water, it means you need to initiate. So now every person dreaming of water assumes that they need to initiate, but dreaming of water could mean 1,000 things. It could mean a lot of things. So now people are under the illusion, some of them, that they're actually initiating and they think they have a calling to become a Sangoma. Kanti, it's mental health issues just masked as I have a calling. So this is why we avoid putting out certain information, because then people just assume because life is difficult, and it causes all of this confusion, and people's lives end up in danger actually through all of these things, because now you're going to a shady Ndumba day thinking you're going to get treatment, and you actually find that that person has no idea. All of the information is from TikTok, and this poses a problem.
Just on that same topic, I just want to find out, right? Because from what I'm hearing from you, there is a lot of secrecy, which Brandon already covered. It's quite important, safeguarding the tradition, and sort of not parading
keeping it genuine, keeping it.
But in the same
authentic.
light, would that not then perpetuate the problem of misunderstanding, of people not really knowing enough about initiation? And like you're saying, I dream of water, maybe that's the sign. Because there aren't any clear sort of guidelines to say, okay, so if your child is undergoing this, or if you are undergoing this, or if, these type of things. Even within the Zulu culture, Xhosa culture, African cultures, to say, okay, who are we safeguarding this from? Is it from ourselves? Is it from other Sangomas? Is it because if we ourselves don't know what, the ingredients of you needing to undergo a certain tradition, then anyone can undergo it. Then anyone can say they have a spirit.
Well, no, not really. So I feel if it was kept as sacred as it was supposed to be, then as a gobela, if a person comes to me and they say, look, I'm dreaming of 1, 2, 3, 4, 5, and this is what I'm seeing and this is what's happening to me, then immediately something clicks to me. And if there's no external influences of you seeing those things, then we know it's genuine. So if you, for example, are always watching How to Get Away with Murder, for example, your dreams, they start to mimic certain things. Your subconscious starts speaking to you about certain things. So if you consume enough of certain information, then your mind convinces you that this is your reality. And so the more that you hear it and the more that you see it, then you convince yourself it's real. But if no one was telling you about water spirits and dreaming of elephants and dreaming of this and this, then if it comes to you, you sort of blank and you don't know. If you go for a consultation and you say, look, this is what I'm seeing, then the Kobela already knows that, okay, this is an indication of someone who's genuinely twassing, as compared to someone who's consuming this information every single day on social media and convincing themselves it's their reality.
I see.
I think that makes a lot of sense, you know.
Just to also add on that, for me, it boils down to the fundamental thing, which is this is a spiritual journey. And for one to understand it completely, you have to first go down to the fundamentals of understanding what spirituality is, you know. So just to also add on what Koko has already mentioned, that as a healer myself, when someone comes in for a consultation, it's within my rights, and as well as for me maintaining the rites of passage, as well as the rules that govern us, to make sure that I follow protocol and procedure to ensure that my client is not only safe but also is getting the best help possible.
Yeah, that's actually, I mean, I feel it's actually more organized. As doctors, we just finish school with A's, and then we say, I've got a
A's?
calling.
Who got A's?
Well, I hope.
Yeah.
I hope we did.
Yeah.
We just finish with A's, and then we say, I've got a calling to be a doctor. You know what I mean? And when we're studying medicine and people say this
and I mean,
is a calling.
the differences between you guys and us is like you guys are very secretive, whereas we call our whole family, we stand on a stage, everyone says, well done, you've done this thing, you've achieved this great thing. And I think
I've just noted, like, she's calling you Makulu, you calling her Gogo. How do we actually address you?
yeah, what's the
Do
term?
we say, is it Sangoma, is it traditional healer, Umtagati? What is it?
Yeah, just
Nyanga?
explain a few of those terms that he's mentioned and what's
How
the
do
most
we-
appropriate,
yeah,
because we've
okay.
heard all of these terms.
So people throw around the terms very loosely, but you need to understand that it is mainly structured in terms of the gift that one possesses. So someone that is referred to as Inyanga, the child of the moon, is someone that is more of a herbalist. Someone that does healing through herbs, shrooms, and so forth. Sangoma comes from the word ungoma, which it loosely means a song. So you are called, you are summoned through dance, through sounds, through nature's voice to act on the gift that you have been given. So somebody that is a Sangoma is someone that went through initiation, the whole 18 months for me. Someone else could be shorter or could be longer. Someone that is Inyanga, someone that you could find that you grew up around someone that is a healer, that knows herbs. You don't necessarily have to go through initiation to be Inyanga. You can just apprentice and learn the different kinds of herbs that we use for different uses. And then Umtagati is someone, everything exists in polar opposites. So whatever is in the light, there has to be an opposite for that. So that's what's on the other side.
But they exist.
Definitely.
Definitely.
But can you be both?
No.
You can't.
You can't be both. Well, some people say you can, but look, I know most people say that you can, but from based on observation and the little wisdom that I've gotten from Islam, is that iskwama sigai too, right? True. You have. Okay, it's hard to speak. Yeah, it's hard to speak Sangoma things in English. So
No, it's fine. Speak your truth.
You have two
We'll
bags.
translate here.
One of light and one of darkness, like in everything. So if the hand that heals can't be the same one that kills. So now in my Ndumba, if I start to dish out ikito and things to ruin people's lives and so forth, I can now use the very same dirty hand to be healing those same things that I am now causing in people's lives. It doesn't work that way. So once my squama is dirty, my clientele is now people who are dirty, who are coming in to ruin people's lives and so forth.
So maybe, Jose, is it a point of you can, but it's not
It's a fine line, actually, because all of us get tested. All of us. You find a client that walks in, sorry to disclose that, but you find a client that walks in, tells you that they want to rob a bank. I'm just throwing something out there.
Yeah.
Give me something that will make sure that I don't get caught. I'll give you 20% of whatever I make. So it's a personal decision that you have to make as a healer, whether you hlanganisa the magic for that to happen or not.
Yeah. So what?
So that-
yes.
Come back from that though, but once you hand out that unity, you can't now come back and say again,
Absolutely.
I'm now going to heal
So
somebody.
basically,
I
HPCSA
see. So-
finds
so
out you if what's it again? The mteto kashoba.
Mteto wa shoba.
Mteto washoba.
No, wait. Let's
Shouldn't-
just correct that quickly. So umthetho weshoba is a bunch of guidelines, yes, but it does not.
It's not an actual body or
there's
council?
yes, there are associations that sort of
Councils.
like councils that are supposed to be guiding Sangoma.
So, for example, in South Africa, it's illegal for me to help you commit suicide as a doctor, but I can do it, and I can use ways which people won't find out that I done it, and I can feel fulfilled that I helped you pass away in a more humane manner, though it's
through-
illegal.
Maybe you are suffering. Or
Yeah, though it's
had a
illegal.
terminal illness.
So is it perhaps similar that I can have the ability to help you, but should I really actually help
Hence, I said to you, it's a very fine line.
Yeah.
It's just a decision that you have to make. And your conscience and the person that walks with you, once you take that kind of decision, it will always rest on you.
on you? Yeah. I mean, it comes to what she says, that you'll have two bags. Even as a doctor, if I do that, one day, in 10 years' time, if I'm caught, I'll be labeled that corrupt doctor, even though I've done millions of good things in the past. So you'll still be have that dirty bag, even though you have hundreds of good bags. So yeah, that's what I get from it.
This just referred to something very important. When he said something about ukhamba with something, like there's well, according to obviously I'm extrapolating what he's saying, that when you are Sangoma, there's obviously ancestors or certain, I don't know, it's people in your family who are sort of guiding you within your path. So is it possible now for these people to only be guiding you for his trito? So
What
I
is
mean,
this Clito?
so only the bad. So I mean,
Yeah.
whenever someone
For
comes to
myth.
you for advice, just for advice, maybe they're struggling at work and they want good advice. You know, they just want a solution,
Yeah.
right? You never have solutions for them. But when this guy comes, like you said, wants to rob a bank, you always have a solution somehow. So is it possible to also have
So
that bag, that dark bag?
to give you I always like in my teachings to give you context before I answer the question. So with all healers, we go through the rites of passage, right? And part and parcel of those rites of passages is basically uklambulula, basically cleansing those that you walk with. Because you need to understand some of our ancestors passed away in a very painful manner. So you find that in your dad's lineage, there's an uncle or an old grandfather of yours who was part of the human trafficking back in the day, died at sea of some sort, and was never safely returned home.
Okay.
So when that person consumes your body, they're always going through trials and tribulations. So it is your part of your journey, basically, to ensure that that person becomes a good spirit that provides enlightenment, that gives you solutions and not just attract problems.
Okay.
So you have to go through certain cleansing processes before, and it's not only for people who are healers. So sometimes there's a client who comes in and they're struggling with depression, for example, and they've gone through the Western ways of trying to fix this. It's just not going away. It's because they are embodied by people who died with severe depression and so forth. And so now when that spirit comes back and it embodies you, now what happens is that you are struggling with this depression, but nobody can get rid of it. And a simple cleansing of some sort is what will allow you to function properly and to actually step out of that depression. So lots of, and you see this a lot with Black families, right? Lots of our ancestors died suffering, they died poverty stricken and so forth. And now you look at Black family dynamics, and this is what you're seeing a lot. And most people are not connected with their spirituality, and they're not cleansing and healing these past traumas. And now you see this repeat itself generation upon generation. But then once they start to connect and they start to get the cleansings and they actually start to heal past generations, then you see that the circumstances and the situations suddenly change at home, because you're healing past traumas of your ancestors, and now they're able to function from a more healthier space as well. Yeah.
Sure.
I see. No, I think you guys have fairly well aligned what you guys stand for and what it is to be a Sangoma,
A lot of insight.
and the light and the dark. And I think I'm sure you guys can see that there's one chair missing. And there's a guy who has a couple of questions specifically about Umtagati, because he's had patients that has suffered the consequences. So he's going to come in a bit later. He's currently busy operating, literally, and he'll be here to ask those questions. But I think now there's some interesting stuff that we've noticed in the hospital corridors. So before we get into the differences between us and you and how we treat versus how you treat, I think let's start with a very common one that we see. Can you explain what's the safety belt and the captain? What do you call that?
It's like a captain's armband in soccer.
The captain's armband. So oftentimes we have patients, I used to work in the surgery department, and we used to have to, everyone used to stand around the table and go, hey, that belt. Who's cutting that?
Yeah.
No, and then I'm Muslim, I'm Indian, and I'm looking at that. I don't want that bad luck on me.
Especially once you've seen it in more than 10, 15
And
patients.
it's not just the safety belt. There's bags on it with things
there's little
inside.
bags.
So now you cut. You don't know if
trinkets.
there's a spirit gonna come out of there for you or what.
We are scared. We don't know. We want you to tell us.
I think what always makes it worse is the staff. Sisters in the theater, they all go, doc, you can't.
Yeah.
And you're like, no, sisters, how? You just cleaned the patient, you prepared the patient.
You've done everything up to this point.
Exactly. And you just didn't touch this one thing. What is going on?
So tell us, guys, what is going
What
on?
is going on there?
Do you want to take this one?
This is a serious one. Yeah.
Answer.
Yeah.
So from the word itself, safety belt.
Okay.
The basis of any, we call it ipitani, right?
Ipitani,
Yeah, we call it ipitani in our language. So it could either be administered by a prophet, so somebody that went through initiation but the church route.
Okay.
So it could be administered by them, or it could be done by isangoma. The basic fundamental purpose of that is to protect and align the person that is wearing it, and to fend off whatever challenges that they face.
Okay.
So that's the basic one. And then the colors of that depends entirely on what that person was suffering from. What are they fending for? Or what are they attracting? So that's where the colors come in. And then the ones that Nklanka is referring to with the pockets, it depends on the severity of what they are dealing with. The one that I can share easily is someone that has been had numerous gunshot attempts, or they were marked by a gunshot, or they were shot at a couple of times. Or within their consultation, you see that this person could suffer from a fatal wound via gunshot. So in that bag is a culmination of herbs and different stuff that I can't mention that protects against that.
Can we cut it in surgery?
Yeah, that's it.
Without getting the consequences.
What does it mean for us?
Yeah. Are we going to get shot now?
We take now everything.
No, guys. No, it can be re-administered. Yeah, if you cut it under the circumstances, it's okay.
Okay.
But the owner, the owner
I
of the
was worried,
belt
man.
is given
Talking about
terms and
gunshots
conditions.
here.
Can I ask that? Is there any sort of umthetho about tightening it? Because I don't mean to paint this picture in your mind, but there was a lady I once admitted in the casualty who was she had a psychotic illness, right?
Right.
And she smoked a lot of drugs. She smelled like dacha, like strong. And she was also psychotic. But the main thing is that the safety belt had eaten into her stomach. Deep into her stomach. You could literally lift her stomach and see the inside layers of the abdomen. Wow. Inside. So I don't know, was she tightening it?
Yeah. It's her.
That's probably a her thing, because I don't think there would be a healer who would recommend that someone wears ibande and tighten it to that extent. So that's again just recklessness of the patient or the client.
So maybe
itself.
in her mental illness, she was tightening it and left it that way, such that it ate into the.
Or she was wearing something she wasn't supposed to be wearing.
Absolutely.
So that's another thing. Guti,
Okay.
in the world of the spirit, there's a lot of reactions to certain things. So if my ancestors are super clean ancestors and they do not agree with certain herbs, if you take those herbs and you put them in your body, they will retaliate. And Toguti, that was one of those retaliations of get this thing off. What is it doing on your body? We don't agree with this. Just like when you're going to give a patient medication, you need to find out, are you allergic to anything? Have you ever had an adverse reaction to certain medications? You also, as a healer, before you give someone something, you need to make sure that this will actually agree with the spirits they carry and so forth. And before you administer anything, make sure is this patient not allergic to these herbs? Well, allergic.
Sure,
you know
that's
what I mean?
very eye-opening. Very, very eye-opening.
And as a funny note, just like your normal waist belt, it has loops.
Yes.
So when I make a safety belt, you give a client allowance to say if you gain weight, you can.
Okay.
If you lose weight, you can.
So it could be even possible that her mental illness was also a reaction to perhaps the incorrect stuff
Yeah.
she.
Yeah.
Oh, okay.
Potentially.
Yeah.
Now tell us about the armband.
Similar.
Similar, depends what kind of healer you went to.
Okay.
So, to use terms that maybe you'll understand, someone that graduated at a different university won't administer medicine the same way that you
Of
do.
course.
So it's the same thing with traditional healers. Yeah.
But avoid a fight with someone you see with that belt.
Yeah,
I'm
what's
just
that
saying,
thing?
Physical fights, yeah. So ogunye, it's for uqinisa,
Yes.
like uqinisa umuntu. That person can slap you into a coma.
Yes.
Yeah, literally, like one slap in a coma.
What does it
so
do for you?
Avoid. It's to protect. It's to protect you. You see, most men, you'll see it more on men than you'll see it on women. It's and it's normally your how can I say this? Like people who would be involved in armed robberies and so forth and whatever, they have a band. It's just for extra strength and so forth.
What? So it could be used for good or evil.
Yes.
You can be used for protection or
And
for
it can
attacking.
yes.
And in some
Wow.
cases, it's to assert dominance. So in a person with that belt, as soon as they enter the room, they have that aura that I'm the alpha male in the room.
Ah.
So when this guy speaks, everyone listens.
Yeah.
When he says this is what's happening, this is what's going to happen.
Ah.
So you see it a lot with taxi owners,
Okay.
so forth.
So wait, so in order for them to get, I know this is wrong, but we keep on referring to it as captain's armband.
What is the term? What is the
It's Ibande.
Iban.
Ibande?
So in order for them to get Iban, because these bandes seem like they're not really the same anymore.
Yeah, that's not the same.
This bande seems to be associated mainly with dominance.
Yes.
Right? Do they undergo then a different sort of way to get it? Is it? Is it just
Can he walk in and say?
I
he
don't
wants-
want here. I want.
He wants
this one.
dominance. Yeah.
I want dominance.
It depends on how the healer you go to works. It doesn't matter where I put it.
Yeah.
Just as long as I put it somewhere on your body. Yeah, so we can't go into details, obviously, of what goes into it, how you do it, and all of that. And it's not every, like, for example, I don't make amabande. I can't make amabande. It's not something that my ancestors have taught me. So it will, but I know it doesn't matter where a person, you could put it on your leg, on your arm. It doesn't matter. The point is it has to be attached to your body for it to be able to work. Yeah.
No, great, guys. The next question I wanted to ask, I think Nhlanhla wrote this one, so maybe he can read it out. Why do... Yeah, Nhlanhla, you ask the question.
So why is it that... Actually, I'm not even sure if I should say Sangomas, but why is it that when someone has a spirit, they have to... I'm trying to... There's a certain burp. There's a certain burp that they do all the time.
Is that the bodla? That's
Yeah,
what
it's a
you're
bodla.
Okay.
Why is that? I don't understand. What do ancestors have to do? And it's always in... I feel in public, or maybe it's because...
Yeah, me personally, the one I would... Hey.
Is it?
That's the one I've heard. I don't know.
Let me put this in context, right? I was seeing a patient, and this patient had basically end-stage disease, eye problems. So I was basically breaking down bad news, telling her, we've done all we could. There's nothing else to do, and we're just going to try and maintain whatever she has, right? And then she went obviously on a tangent trying to explain to me that, things happen in life, that I will never be able to explain. Then, I first gave her that face like, do I really want to entertain this? Then she went, bleh. Then I said, definitely don't want to entertain this. I've heard that border before. I know where this is going.
You don't want to entertain this.
So I just need a bit of understanding. What does it mean?
Okay. Do you want to tackle this one?
Yeah, yes and no. So this is one of those questions.
So let's go with the yes first. And then
this is one of those questions
carry on.
where I would have said I don't want to answer because it's so difficult to explain it. So especially in English, yeah. So guno moya, right? And
that's a spirit.
yes. And when one says ngihlusha umoya, and how do I explain this in English? Okay, I'll try to explain in Zulu, Marcos. And so what
I don't know
happens?
whether that's from your line show. From Umoya.
So what happens is that when you go to initiation school, ne, bayakushayela so that your dlozi can come through. Ibige guti who are they, how do they want to function, and so forth. So we can't explain this without sounding crazy. But what happens is that you feel umoya coming from ngenzansi all the way up to bwa.
Okay.
To come out, and it's sort of like your spirit is bigger. I don't know how I can explain this.
Yeah.
It's overly exaggerated now because people drink Coke and they blah 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 the whole day.
I was
right?
about to say that.
Yes, but in essence, you see, the whole bottling thing doesn't happen to me often. But when I do go, blah, I know, Uguti, okay, there's a certain Kehla there who's now there with me trying to communicate something very important. And that's an indication to me that, okay, umkulu figil. But for others, it's now difficult to tell what is what because people are just
how
blah,
do you
blah,
differentiate?
blah, blah.
Because I mean, you are pregnant. Congratulations. And sometimes I know pregnant ladies, they have the
Yeah.
gas, and now you and
No, there's a difference. There's a definite difference. So things of the spirit, you can so much tell when someone is fake, and you can so much tell by their aura, by their presence, because
how do you personally tell?
You are met by the person. You see, when I met Umkulu by the door, you are met first by the person that they are with, all right? So he can correct me if he wants, but like today he's carrying mostly ugogo wake that came in before. Like when I met him, I met ugogo wake before I met him. So this is why you will togozisa.
Okay.
So that's how you can tell. And then some people are just like, a person is empty. They burping the whole time, so you expect that there's going to be a change in the aura, in the environment, and then there's nothing. Then you just know, this one is Coke. But if someone is like burping, and then you start to feel like, okay, there's a presence, then you know it's okay. umkhulu or ugogo ukhona.
Does it happen in a setting where you are expecting intervention, or can it happen anytime?
It can happen anytime, even on a date, which is very embarrassing.
Just to add more context.
Yeah.
So Sangomas, we go through physiological experiences. So it could be spasm, it could be a headache, it could be burning eyes, could be a very sharp pain to your spine. You can suddenly feel chills. Your feet can get hot.
Okay.
And sometimes it's an indication of the kind of patient that you're going to receive. So if you are coming in, suddenly my neck gets stiff. I get chills around my back. I already know what kind of consultation we're going to have and what are the challenges that you are facing. So in a way, it's a way that the people we work with communicate with us to let us know either your environment, your setting, or what you are going to face or what you are going to deal with. And in a case where you're on a date, the anxiety levels also can cause that, you know. But to echo Gogo's sentiments that you can actually feel a person's presence that, nah, this one is just seeking my attention.
Okay.
So something that I do on the side is curate DJ. So because of the jewelry that we wear, suddenly people around you will start burping.
Okay.
What-
to try and
what
get
the
attention.
Mandela said there, you know, like
Yeah.
people are just it's the theatrics. But,
Yeah, but
yeah.
I like you guys' inside info that you can tell that the person you're on a date with on the other side of the table, Kulu has told me this person is not right for me.
Yeah, well, sometimes you
Already
can
you-
zoom it out. But sometimes it takes long. Sometimes you on the 5th date and now only they tell you about this one. You're just like, why didn't you tell me the first
This is
date?
the problem.
Now we could have used your help in our life. We have wasted many a night.
I choose to remain silent.
Yeah, no. So I mean, it's very interesting that you guys also do come from some. I mean, you're a psychologist, psychology graduate. You're a doctor, a dentist, and now these worlds have collided, and I specifically want to delve deeper into like the differences between us and you, and then your experiences as being both, and how you navigate that. So us here at the Gents Clinic, you know, we specialize in treating men's health and reproduction issues. So we'll start with that, and maybe you can touch on that a little bit. The most common thing that we see in our practice in this country, and I'm sure worldwide, is premature ejaculation and erectile dysfunction. Now, is this something that patients will come to you for assistance and treatment for? And is this something that you treat?
You want to go first?
Yeah, we do see this a lot in Dumbeni, but we see it for many different reasons from you guys. Some reasons are very, very superficial, which would be just change your diet, you know, also less alcohol, things like that, which is like your superficial base. That's more on the medical side. But then you have deeper issues also that I don't want to sound crazy like explaining these things, but you have like deeper issues also, like deeper rooted issues. Like for example, you can have someone who is, you know, maybe you're married, but you just keep on cheating on your wife, and you're sleeping with this one and you're sleeping with that one, and ancestors are just like, that's enough. We're going to put an end to this. Then when you try to go use it outside, now you have an issue. Or you try to use it with your wife, and now you have an issue. So there, it's now issues of ukushweleza, ukezikaya, uklawula, and all of that, and then you can go about your business again as a man. So the reasons are different. There's like lots of things that can come from it. Other things are, some things are more serious, where, you know, it even goes into the issue of infertility, where people can't make babies anymore because there's a generational curse that has been put on your family because they're just trying to stop a generation. That's where them tagatis come in. They don't want you to produce further boys in the family or whatever. So they put a curse on you, and now all of a sudden you can't use your manhood anymore. So there are more serious issues, and then there are more of your alcoholism, your stress, poor diet, and yeah.
And
So
so would you say, obviously because you come from the medical fraternity as well, so you have an understanding of there are factors, and we've discussed it multiple times on the podcast about what influences erectile dysfunction and premature ejaculation. And so will you screen patients and ask them about all these issues first and go, okay, we've gone through the necessary due process, and now we've come to the conclusion that actually we have solved all these problems. There's no more further optimization of this. Now we have to delve deeper. Or sometimes you just go straight and say, I can feel that you've got this curse, or
look, it's okay. So before I give it to Mkhulune, I just want everyone to first understand that we don't just go, with like feeling and, just dive straight into something. We work almost exactly the same as how you guys would work. Like, hear me out. So if a patient comes in, the first thing you're going to do, you're going to sit down with your patient and they're going to tell you their symptoms. After they've told you their symptoms, you are now going to, talk about their family history, medical history, and so forth. Right after you've done that, now you do the investigation, right? Physical examination, you check what's going on. Then you come up with the diagnosis. You sit down with your patient, you discuss a treatment plan, find out which medications are going to work for the patient, and so forth. This is how it works in Dumbeni. A patient comes in, but instead of the talking and them discussing with us what they think, you throw your bones or you light your candle or you do whatever you do to get the information. Right after you've gotten the information, now you have a diagnosis, you look for treatment plans, you talk to the patient about what needs to happen, and then you administer the treatment. It works exactly the same. So this is how we would eliminate the issues of, okay, I don't see anything deep here. It's just that you need to fix 1, 2, 3, 4, 5, and then you send them away. But then if you check and then you see that there's a deeper issue here, that's where you start to go into things of the spirit and you start to handle
Kosi,
it.
you want to add to that?
Yeah. So with the time, obviously we learn different ways and different means of healing. So now my approach is holistic. That's where I take a bit of the psychology into it, see what the person is actually suffering from a mental state point of view. Because you find sometimes with such issues, it's something that is mentally happening. So you find that the person is A-okay when they're outside, but as soon as they get home, they feel emasculated, they feel they're out of place. Suddenly a guy is no longer employed, the wife doesn't make him feel like a man anymore. So those are some of the adverse effects of mental issues that can affect that. So during consultation, through conversation and through checking, some of these things will come up. Like, okay, I've picked up that there is X, Y, and Z between you and your wife. What is transpiring there? Then you open up to the client, see how that they respond. Even though you already know what the answers are, you still need to build that rapport with your patient so that they're open enough to discuss their matters with you. And then, so when it comes to actually treating it, we take the similar approach, holistic approach that I don't just isolate an issue. I treat the person as a whole.
That's very eye-opening, man.
Yeah, it is.
It's really...
So just to clarify, because there's just some stuff that I'm a bit on the blank on. So the big differences here would be the fact that you use the spirit to get the symptoms and that's the investigation, symptoms and diagnosis. So the rapport... you still ask the questions.
Maybe it's similar to us. Like if you come to me and I look at your hands, I look at your teeth, I know you smoke, but I still ask around, do you smoke?
Yes.
That type of thing.
Absolutely.
I know already you drink a lot of alcohol. I can see you have a tremor. Your blood results show your liver is telling me you smoke. You drink, but I still ask you, do you drink? And then you say no. And then we go further and further and further. So
it's similar to that.
less, not like a little bit, but it's less talking from the client in terms of. So the only thing that makes a Sangoma weird and different from a medical doctor is that the way in which we get our information is supernatural in a way. So it's less talking with so there's more pressure on you as the healer to see into the person's life and how accurate you are in seeing certain things, like how he is mentioned that you could have issues with the wife. The client isn't going to come there and say, I have issues with my wife. You have to figure it out from the reading and the seeing and so forth, and then from there you can say, look, I'm seeing here that you have issues with your wife, this and this and this is what I'm picking up is happening in your home. And then they say, yes, indeed, this is what's happening in my home. Then the conversation starts. But they're not going to come in and say to you, I'm having issues with my wife, because then you might as well just go to the hospital and get your clinical...
Exactly, So have you guys ever had a case where someone walks in, they sit down, they're here obviously to consult, you throw your bones, you then say, sis, why ulala ngaphandle? Or do you know something that you're finding from the bones? And they say, but Sangoma, you're out of order. There's no such thing. What's happening there?
You know what?
Yeah, basically, I think.
So it's like you're wrong.
Yeah. Because sometimes we misdiagnose. Sometimes we don't have all the answers. Is that something that, is that something that you guys have also experienced in your time? Misdiagnosis? Is that something that's common?
I wouldn't say so. Look, what happens is that sometimes the issue that I found with specifically to my practice was that there was a time where I almost lost confidence in my practice because I didn't know at the time that I can see more of things that are going to happen in the future than things that are currently happening. So I connect a lot with the past and a lot with what's going to happen in the future. So you tell someone this and this and this, and they're just like, no, not really. And then a few months down the line, they call you and they're like, hey, Coco, remember that thing? It's happening exactly the way that you told me. Now, how do we tackle this? So Idlozi isn't wrong. Idlozi doesn't get things wrong because that's information that you're not getting from yourself and you're not making educated guesses. There's a message that is specifically being relayed to you. So the timing of it, whether it's in the past, the present, or the future, that's what's sometimes difficult to place as to, okay, this is, but to be flat out wrong, hardly.
To add on what she's saying, so when you walk in as a patient and you come to Hlola, the people that you walk with, so how I usually describe this, think of Arthur and the Round Table and his knights. So everyone walks in with
as
their...
we are now.
Yeah. So this is you and your ancestors sitting around the table. So not everyone around the table is going to speak out. They'll always have that one that they're like, Brandon, you're the spokesperson for the family. So Brandon will not disclose everything that is a problem for everyone. He'll specifically say, this is what I want this child to fix, or these are the problems that we have with this child, or these are the things that are happening currently with this one. So if Brandon doesn't touch on what brought this person here, then it will not come up in my consultation because that's not the message that I received.
Okay.
Do you get it?
So it's important for direct, clear communication.
Yes. So that's why,
understanding,
even when we get, I don't want to disclose how we go about our duties in the Ndumba, but when you call upon the person's family members, alive and not in the other world, you ask that they come with solid answers so that we do a complete, holistic consultation.
Do you find that some of your patients get frustrated? Like with us, if we don't have a diagnosis the same day, they might go around and shop at other doctors.
And you pick it up. We pick it up. As soon as someone walks into my surgery and they come from someone else, I can smell it.
Okay.
Like, no, you have
elsewhere,
Dr. Vilagazi's medicine on you. I can't help you.
So you can't even. So if they've gone to somebody else already and they've started their healing treatment process, you can't intervene at that stage.
You can. It's like comparing notes, because sometimes they'll go to one healer, go to another. She will pick this up. The other one will pick something else up. I'll pick up both of that and something else. And then the client will decide where they want to.
Would the ancestors maybe be upset that you're jumping around because they want to give her all the information, but
They do.
yeah.
And in most cases, they'll tell you, we want you to go to that person. However, you don't feel confident in disclosing your problems to a woman, so you'll come to me. And only to find that I don't connect with the person that actually wants to give the 411.
So it's also not it's not something that's frowned upon. Like you as this healer can say, "Nah, I'm not the right person."
yeah.
You can even refer to another healer.
I see.
I was actually surprised when you asked about erectile dysfunction, if they see those patients, and she was nodding, yes, I see. I was like thinking that men wouldn't go to a lady.
But they don't come in and say, Coco, I'm having issues. I'll pick it up. It's okay.
Okay.
Things with mama at home are no longer. And he'll be like, oh, yeah.
I want
I
Even
see.
with the mamas, you can tell the stove is not going on.
Yeah, no, I mean,
You can pick it up.
the stove is down.
and that's kind of the reason why we started this whole initiative, this company, this podcast, is to discuss things because a lot of patients feel very uncomfortable, and so it's funny that you guys even mention it, because even sometimes when we consult with patients, that's not the first thing that they outwardly will come out and say. So that's why, like, having a computer screen in front of you and talking to someone through that helps them. Thanks for watching this far. As a valued fan of the Gents Clinic podcast, we'd like to offer you a discount on your first consultation. So use the coupon code GENTS20, all caps, and you can get 20% off your first consultation. If you're having problems booking a consultation, here's the number on screen. WhatsApp us and we'll help you get a booking. Now let's get back to the podcast. But two quick rapid fire questions I want to ask you, which just caught my mind when you were chatting. Do you guys charge, one, for your consultations, and two, what if someone like me wanted to consult? Like I'm not. I don't look like him. I come from a different faith. But I live in this country. I'm a South African, so maybe I have. I don't know. Can I come to you guys?
One, yes, we do charge for consultations.
Is it like a
and
fixed
treatment.
rate throughout the country, or is it based on your?
Oh, some people are wilding. I heard one lady say she consults for 1,000 rand, and I was like,
Sure.
I
need
see
to
my
start
ancestors?
burping.
that for me, that is crazy.
That is
Because I was
crazy.
just wondering, like,
Wow.
what kind of consultation are you doing? Do the ancestors come out and talk on their own? Like, what happens there? And then the cheapest, I think, which is like standard for most people, would be 150 rand for a consultation. Yeah, so it just depends, but obviously it's up to a person's own discretion with how much do they want to charge. And the treatment also, we do charge for the herbs and so forth.
That one's getting a cut from some heist or some bank or
Yeah.
something.
That's the bank heist. That's the bank heist charges.
Crazy, yeah.
But because the reason why I'm asking, and I mean, I don't want to be too controversial here, but if it's a spiritual calling, right? If it's something that you are, we didn't get a spiritual calling to become doctors.
Yeah.
I think, I'm Indian. My father was like, either you work in the shop or or you go there. For these two, they'll tell you their stories. But, so it wasn't I'm not suggesting that it was a spiritual calling in that sense. And there is obviously a lot of controversy about, how much doctors charge these days and things like that. But for you guys, I'm sure a lot of people, maybe in your family are going, how dare you charge? How dare you ask me to pay you when this is something that you have been called upon? This is a noble thing. I even get asked randomly for advice at family gatherings. And I'm like, I have a whole website where you can book a consultation and come and see me. But here you are asking me to write you a prescription for your pain medication, So how do you guys navigate that? And do you feel like it's ethical and allowed for you guys to charge?
Just before they answer, just maybe to add on, I think our profession as medical doctors was also noble and for the community and peacekeepers. Back when, I don't know, when did the medical profession start with Socrates and those guys?
Yeah, back.
But you used to do house calls, and even the Hippocratic Oath, speaks about service and so forth. So, but as time went, we monetized it, and now,
Pharmaceuticals.
yeah, and now healthcare is an economy. So I'm just adding on before they actually answer that
And
there's
you
two
hit-
sides to it.
Spot on, because as much as we try by all means to dig our own herbs, I mean, I try every 3 months to go to Mpumalanga, to go to Botswana, to get certain herbs that you can find in the country. You have emergency cases where you don't have the time to go that far. And I mean, some herbs, you dig them at night. You can't dig them during the day. So in such emergency cases, you have no choice but to dive into that economy. So in that sense, traditional healing has also become an economy. I mean, the cloths that we wear, everything that we use, you get it at a shop now.
Yeah.
So on the same breath, the person that is selling that is selling it at a price. And then you need to pay for that. So unfortunately, it's a fine line as well where you use your discretion, because you do find patients that come in and you can see that this person didn't even have a meal today. They're still trying to figure out what they're going to eat that day, but they need your help. And as soon as you can help them align their stuff, something will materialize. So you use discretion in that sense where as soon as you're okay, you'll do the right thing. And the patient will come. Some do, some don't. But some do come and like, hey, Mkulu,
Thank you.
I got that job. Hey, thank you. Here's something. Some clients will thank you and say, look, I can do acts of service. I'll do your gardening. I'll clean your car. I'll do something in return for what you've helped me with. So you use your discretion in that sense.
And I think that's still the same. I mean, we would also sometimes help people, and they come later, whether they've baked some cake or whatever, and say, thank you, doctor, you went an extra mile for me. I know in the Eastern Cape, there's some doctors at some rural areas who get paid with chickens or with the eggs or the milk, from the cows and things like that, from people who can't actually afford. So I'm aligning things a lot as we're going along here.
Yeah.
To say that we're actually quite
Don't start
similar in a
bored.
lot. I wanted to ask a very maybe sensitive topic, and just make a small disclaimer that I'm not making excuses for men. When someone is bad, they go to court, they get forgiven, they show remorse, but they still spend the time in jail. So you can have a reason that I was raised in a terrible way and now I rape, but you're still going to be judged for it and go to jail for it. So I want to speak about gender-based violence and men who beat women or their partners. Do you ever get these consults from men who abuse women? And are there reasons for it? Not excuses, nothing to say it's allowed, but reasons, maybe spiritual reasons, maybe they unsettled or, I won't be able to describe it best, but gender-based violence is a big problem in our country. And we struggle to understand it as a country, why men abuse women so much in our country. So maybe from the traditional side, from the spiritual side, is there anything to be said on it?
Sure. Okay. So first of all, as a woman, for me, speaking on this topic, especially like on a public platform, sometimes I shy away, because if you look at the spiritual aspect of this, sometimes, this is created by women in men. Kona, this thing that is called idliso, that's your love potions, right? So the long-term consequences of idliso, or some of the side effects of amadliso, is that a man becomes very, very obsessed with you, and they become very, very violent. It's a side effect of it.
Okay.
So that is one of the reasons affecting most of your South African black males in terms of gender-based violence. It's a topic we shy away from as women, because if you say it bluntly, it's almost as if you're making excuses or promoting gender-based violence. But that's not. It's just one of the contributing factors. Most men, black men, are under the influence of Italy. So you would be surprised how many men think they are happily married. Gandhi, have been forced into that particular situation, and you see and you watch your man become somebody different. Now you're like, okay, now he's at home, he's no longer leaving, and he only has eyes for me. But this man is now violent, and this man is now aggressive, and this man is now obsessed with me, and he won't let me leave the house, and that is just a side effect. But sometimes, again, there are other issues that have nothing to do with Italy. So some of the things that we touched on earlier on, you have spirits of people living in them. Someone died a violent death. Now they are with you, they are not cleansed, and that spirit is acting out, and it is causing a person to act out and lash out, and they're abusive and so forth. So I don't know if Umkulu, there's other spiritual elements to it that you want to add, but mostly it's uncleansed spirits as well as the liso aspect of things.
Absolutely. The only other thing I can think of is we as black people don't understand our lineage. So you need to know the family history, where you come from as a man, so that you know what are the things that your family members have endured in the past, what are the things that they've experienced. Because some of the times you find that patients will come in and they don't even know their own fathers, let alone their grandfathers. And those things add up to the kind of person that a person grows up being, having that type of resentment towards the opposite sex. And again, to Gogo's point, the need for dominance as well. So I touched on this a little earlier, that men lately have this thing that they don't have their place in society. And men don't have many spiritual outlets, or any outlet for that matter, to share or voice out their frustrations. So the only place where they feel they can lash out is at home. So it's funny because we always joke about this thing that if your woman beats you up, you won't go report it. Instead, the gents are going to laugh at you and be like, hey, brah, handle that. But that time your wife is very violent. You know? Women can easily meet up and chill as a group and talk about these problems, but gents don't have such outlets. So a holistic approach to this, I think, would be the start for us to address these problems.
No, very, very interesting. I mean, I think that we touched a lot on the issues that we deal with, and I think what we want to also get a sense from you guys is, at what point do you say, I think you need a doctor? I think this is beyond my realm or my scope, I have helped you, or I cannot help you any further. Now you need to seek help. Here's a letter, go and see a doctor. Or, because on the other end, what it seems like to the medical fraternity is that Sangomas don't believe that doctors work. And in turn, we don't believe that you guys work. And so neither of us are going to meet eye to eye. So we don't trust each other. So we're like, no, if they've come. So it's very common, when I work in the emergency unit and when patients come in, a very common question is, have you been to a Sangoma? Have you been to a traditional healer? Oh, what did they give you? That's why you're having. A lot of the time, it's ingrained in us. And I'll give you a quick example is that oftentimes I have seen some patients who have been to traditional healers and they've given them some sort of a herb and it's caused them to be in liver failure or kidney failure. They had some other issue, let's say a chest infection, etc. And now they've had these herbs, and now they've come in with this issue. So my first question is, do you refer? And secondly, when you are giving treatment, is there a possibility that some of these patients are going to false healers and getting the wrong type of herbs, wrong treatment, and then ending up with worse problems?
Okay. To answer the first part, we do refer.
Uh-huh.
As part of my consultations, as part of the first questions that I ask, have you seen a doctor? If I do pick up that this person is suffering from, for instance, I've had a stroke victim, and I've numerous occasions with other clients. I've asked them, okay, have you been to a doctor? What was the diagnosis? How is that going? What medication are you on? Are you taking it the manner in which they told you that you need to take it? And in some cases, you'll find clients will be honest and tell you that on days I do, some days I don't. So that inconsistency, I always refer back and like, hey, they told you 3 times a day when you're taking it once a day. And you're going to combine this with this. And as I said, I do holistic healing. So I'm going to administer medicine from head to toe. So I don't want to mix that and this because you don't know what it's going to do inside. You know, it's the same thing as women that do come see me. I do ask them. So before I administer anything post water treatment or river cleansing or whatever, before I administer anything that you're going to ingest or consume, are you on any preventative medication? Are you on the pill? Are you on the injection? What are the things that you are taking outside of a multivitamin? So that I know, because I've had cases where clients will lie. Next 2 weeks later, she comes back and she's pregnant. I'm like, oh, but I told you that this thing's going to flush out everything. But doc, I was on the pill. Like,
I think it's a very important point, especially when you said that we maybe don't trust you, you maybe don't trust us. And what this talk is helping me understand is that we can actually work well together. Maybe we just don't understand each other. There's a lot of research where doctors are sort of saying that traditional health practitioners don't understand medication. They use things that interact with our things. And I think you can correct me if I'm wrong, that as much as we have doctors who do shady things on the side, there might be also traditional healers who do shady things.
Absolutely.
As well, yeah. And I think that's maybe where we think that if you are a traditional healer, you are shady. You are giving, Whereas the World Health Organization actually said that from 2013 to 2023, we need to combine the two over the 10 years. It's 2023 now. It hasn't been implemented as what the goal was. There's a whole document of collaborating traditional healers with medical Western doctors. Yeah, but it hasn't taken place, yeah.
And Khosi, I mean, you need to also understand a big reason why there's obviously mistrust. Our mistrust doesn't come from a place of, we think. There's actually evidence-based medicine on some of these things. There are some herbal medicine, like common things that are used in KZN, like in Biza, for example. You can actually find some meds on that where they've documented kids who've come in severely dehydrated, who end up having serious complications, liver complications, kidney complications, and it can directly be related to something that they had. Right? So that's where it comes from. We're not just like,
I'm with you.
and I mean it goes without saying, Ruti. Obviously, I mean you are your drugs investigated? Are your herbs investigated? Is there dosing to your herbs? Even though it works. For
me, the main thing is how do you administer? And under what circumstances are you administering that herb, whatever that you've prescribed to a client? With cases of upeita, enema, you need to know underlying issues that are actually forcing you to get to a point where you need to upeita umuntu, or for you to prescribe imbiza to a patient. And the different combination of herbs that go into that tonic that you are preparing, and what are the underlying issues. So the first consultation is always the most important, because that's where you actually know what is happening with your patient before you administer anything else. So to the question that you had posed in terms of authentic traditional healers, that's where that comes into play. Because unfortunately, guys, let's face facts, everyone is after money.
Yeah.
And if I see someone walk in and it's my chance to make money, I am going to cash in, And unfortunately, that's where these issues come in, that we prolong medicine and treatments so that the person just comes back and leaves that whatever 200 rand or 100 rand or whatever.
Yeah.
You know? Yeah.
Just to quickly touch on the point that my second question and what he was touching on in terms of the herbs, because we do see patients with these. Is it just the prolonged use? Is it incorrect use, or are they just getting it from an umtagati, like someone who's evil and wants to poison them?
So sometimes I'll give you a classic example with what clients usually do. So they'll come in, you'll tell them what to use and what not to use, how to use this and when to use it, right? And then you give them an additional instruction to say, only use this for a certain period of time. And on top of that, fix X, Y, and Z so that this thing actually helps you. And go back to your doctor.
Yeah.
And then a person will be like, okay, I heard 1 and 2. 3, 4, and 5, nah.
It's the same struggles we have with patients.
And then,
Exact same.
and then fast forward 2 weeks later, they come back with a crowd of people that Nkulu gave me nonsense.
I see.
And then that's where the problems happen. And then when you ask, okay, let's sit down, let's talk about this. What have you done post you being here?
Yeah.
They can't relate to you what the instructions that you gave them. And that's why it's very important as a healer to keep record of your patients.
Yeah.
So I have files for my clients.
Okay.
Like,
Good.
I saw Mrs. Villagazi the other day. I make a note that I prescribed this and this is what I put in and this is what I was curing. So that even tomorrow, 10 clients later, I can still recall what I actually administered.
Yeah.
That's really, I mean, that's basically us. I
Yeah,
think
yeah,
saying that,
yeah.
in saying that, in what I'm saying is that part of the whole thing of collaborating Western medicine, I think Western medicine, we just want to believe that we are right and no one else can intervene in what we're doing. But also maybe advise us at which point, you said you refer to us, advise us maybe at which point can we refer to you, or when can we refer to you, or should we?
So from that stance, I actually believe that the clients that you guys deal with, it should be part and parcel of your questioning. Have you tried this? Have you gone there? Did you get any form of assistance from there? What was the feedback? Did you take anything outside of what I'm possibly going to prescribe to you? Because in most cases, the most common thing that guys take is impesu. I think all of you know that.
Yes.
Is it not?
Vusinduku.
Yes.
Vusinduku.
They take those, they take that sex coffee,
Yes.
they take those pills that are
Is
sold
this
at
something
that.
that you guys administer
No. I don't prescribe those things.
to other traditional healers?
Yes, they do. It's a quick money making thing.
But so it's not. So what the question I'm posing is it appropriate for a traditional healer to give these things, or is it just money making? It's not part of your
It's not part-
spiritual healing.
So for me is let's cure the person and everything that they're dealing with. Not just isolate something that they're coming to you for. So you find healers that actually just, you know what, during the week I make my money from selling just this.
Okay.
And the 75-year-old man will come there, buy that small sachet of mpesu and go home.
The same, and it's
I
like
see.
doctors selling still pain and sleeping tablets.
Yeah, instead of actually solving
Instead
the
of
problem.
solving the
Exactly.
problem, yeah.
Which is what we try and do. I mean, there's patients with premature ejaculation that are just suffering with anxiety. We have a good chat with them. We can start them on treatment, and then we see them, really being cured from this.
Yeah.
And I know we are running out of time, and I want to end the episode when our Goko is back, because the baby must be pushing on the bladder. So I would rather us end the episode with her in the studio. So whilst it's just us men,
Yeah.
she's- I think
We should
she's
just
feeling
ask those
sick, eh?
questions.
is there anything you guys wanted to specifically ask before we close off today?
Just one from me, one last question.
penis enlargement. What the hell?
Yeah, when the pamphlets, when they're giving out those pamphlets
Downtown.
in town.
Turned. What?
Yeah.
What's going
What is
on
that?
there, man?
We've
Just
heard
assist us,
our
man.
surgeon Vish, who is probably still stuck operating now,
Yeah.
was telling us there's a procedure where they cut what's known as your suspensory ligaments. That's the ligament that holds the penis on the top. So basically, it sits like a V on top of your penis, and they cut that, and then zoop, you suddenly
Basically paralyzing you.
yeah, but
Yeah, like something like that.
But you gain about 2 to 3 centimeters in length, but now it sits a bit funny. He said that this is something that he's seen people do. He's also he had also mentioned that they make the little cuts.
Ukaba, the
Yeah.
testicles, the scrotum, sorry, which is, I mean, a huge risk for infection.
Absolutely.
Yeah. So can you just walk us through that kind of stuff? Do you do it?
Is
penis
that
enlargement?
appropriate?
Is it there?
In my space, unfortunately, no. I see these flyers, I see the stickers on the road,
Just like us.
and
So you are as shocked as we are.
I'm always like, okay. And then to make it worse, you'll hear, because most of our teachings as healers through rites of passage is orally. So I'll take you back to when I was in Mpumalanga. We were sitting around a fire, old men, healers. And they talk about this tree from Venda that you can cut the roots, ingest that, and within days, it grows just like the tree. And then I was like, hey,
That's why I'm a vendor.
apparently. So there's a tree.
That's why they
there.
are well endowed.
We must find this
I'm
tree,
like,
man.
hey, no,
Can
man.
we get this?
Can we
tree?
get this tree?
So,
Please.
as far as
Next month we're going to be advertising this tree on the Gents Clinic.
Yeah, no, but no, it's from my experiences and what I've learned. No, I
None
haven't
of this
found
is
anything.
appropriate.
Yeah, no.
None of this.
These
You also you
screens-
just as shocked. They're giving you guys a bad name.
Yeah.
Okay. Any last questions, Brendan?
No, not from me. For me, it's actually just been really eye-opening. It's actually helped us to understand, and I hope not only the general populace or community society watches this, but also medical doctors.
Yeah, I think
so
it's
that we
eye-opening.
can understand. I mean, we learn at medical school that pain, for example, is physical, it's emotional, mental, but it's also spiritual. You also have spiritual pain, you know. And sometimes, especially, we do it when we're treating someone who's at end of life. Let's say they have an end stage 4 cancer. And we involve a team called a palliative care team.
Yeah.
And in there, you have a spiritual person. But again, it's Western spiritual, you know. So I think it's eye-opening a lot, you know. Maybe those type of teams should also involve traditional leaders. Or like you said, we ask the patients, do you have a faith in your traditional healer or spiritual and so
Yeah.
forth? So I think we still have a long way to go in South Africa in terms of, you know, incorporating, because this is part of who we are. I mean, it was here before colored people came here, or Van Riebeck came here and made me, before you were brought on the ship from India.
Yeah.
It was here, you know. Now we come with these things and we want to disregard it.
Yeah.
So I think it's very important that we had this talk. And yeah, man, I was very shocked with what Ugogo said earlier on. I wanted us to expand a bit on that, but maybe we'll invite you another time.
Yeah, definitely.
on those aspects of GBV. Yeah.
Yeah. No, so finally, before we close, I have one very quick question that you didn't answer. So can I come and consult? 'Cause
You'll be surprised.
I've seen white sangomas. I've seen
Yes,
crazy
I was
things.
about
Are
to
they-
touch on that.
is this real? Can this happen?
Yes.
Can I consult? Can you be a white sangoma?
Yes, you can.
Was Mr. Bones real?
Shucks, how I learned.
Fundamentally, everyone is a spirit, you know. All of us are spiritually enlightened to some extent. It's just that some of us are called to act upon that spirit for it to do its acts of service. So that's basically the definition of what we do. But to answer your question directly, yes, you can. Because whether you like it or not, your ancestors are part and parcel of who you are. And you could find that there are certain things that are misaligned. There are certain things that you are not aware of, but you are acting on them. So just to fill in those gaps, you can see your traditional healer.
Well, it's been very insightful, and I would have liked to end this podcast with everyone here, but hey, when the baby kicks, what can we do? Thank you very much, Josi, for joining us. It's been a very insightful chat, and I'm sure all of our viewers and listeners at home or on their way to work that are listening and watching this have learned something today about our African roots, our ways of healing, and how we can work together in potential harmony in aiding and assisting patients throughout South Africa and, hey, even the world. I can come now, apparently. So it's been great. Thank you. This has been another excellent episode of the Gentleman's Clinic podcast. My name is Dr. Suhayl Essa.
My name is Dr. Untitled Chapter.
Dr. Brendan Matthews.
Mkhulu Vusi Zizwe, Nsizwa kaMlambo.
And it's been another episode of the Gentleman's Clinic podcast. See you guys next month.
Sanmunani, guys. So I'm sure you're all wondering whatever happened to me during the podcast recording. Well, what happened is that my little superstar decided to land a little bit early, and I'm really glad that this happened while I was surrounded by the doctors from the Gentleman's Clinic, because they really took care of me. So yeah, I just thought I should let you guys know that this is why I actually disappeared. And just a little shout out to the doctors. You guys did great in taking care of me and making sure that I deliver a really healthy bouncing baby boy. Thank you, guys.